Thank you and welcome to the show this morning. The topic this morning is prostate problems and new treatment. And we're fortunate to have with us to talk about prostate problems and new treatment, Dr. RBenson. Dr. RBenson is with the Center for Urological Research and Treatment in Nashville, Tennessee. And of course, Dr. Benson, let me welcome you to the show and apologize for gobbling the center that you're with this morning. But we do want to talk about prostate problems and some of the new treatments that will come out of your research center and some of the research that you've done. And before we get involved with that, let's talk about Dr. RBenson. And to have you to give us some information about your background and your education and some of the things that were important and eventually leading you to your research in prostate problems and new treatments.
Right. Thank you very much. It's a pleasure to be with you. I actually grew up on the West Coast and did my undergraduate school at Stanford University, and from there became interested in biological problems and went on to medical school at Johns Hopkins in Baltimore. Actually got homesick, I guess, went back to the University of Oregon for an internship and did some time in the public health service in a tuberculosis hospital in Albuquerque, actually. And then to the Mayo Clinic, where I did my urology specialty training. At that time, I did some work on a PhD in pathology as well. Finished there and was a professor on the staff at the University of Wisconsin, and then asked to go back to the Mayo Clinic to be on the staff, and spent most of my time in the Midwest, where I swore I'd never stay. But the experience at the Mayo Clinic was a remarkable one in terms of the numbers of men that we saw with prostate problems. I subsequently went to the Mayo Clinic in Jacksonville when we opened that facility as the head of urology down there, and continued some of our work with the prostate. My interests in the past have been somewhat varied, centered around prostate problems, both benign problems and malignancies, and also with new technologies. Done an awful lot of work with the use of lasers in urology, and taught laser courses for our National Urology Organization. And I think that's led me into looking at some of the new technological advances that have perhaps helped us with treatment of benign disease of the prostate.
Now, when you talk about the prostate and prostate problems and new treatment and whatnot, many members of our audience might not be familiar with the prostate itself. Exactly what is the prostate, and what are some of the problems that can occur, and how can we recognize those problems?
Surely. The prostate gland, and I can actually show you here, is a small kind of walnut-sized gland that sits right under the bladder, if this is a cutaway from the front of the bladder. It's a gland that honestly doesn't do much other than make prostatic fluid, which is the main carrier of sperm. So from a usefulness standpoint, as one might joke that it's useful sending urologist kids to school because of the many problems that revolve around the prostate. These problems are both infectious problems, malignant problems, and benign enlargement problems. And the evaluation of all of these issues is quite separate. As you probably know, there's a blood test out today called prostatic specific antigen, PSA, which can direct us to prostate problems. It can be elevated with any of the difficulties that one sees with the prostate. And I know today we're going to try to primarily spend our time dealing with the non-malignant, the non-prostate cancer problems. And that basically can be categorized into two main groups. One would be infections, and the other would be benign growth of the prostate, and we're going to center with that. Let me say that infections are not uncommon. We've all heard about prostatitis or prostate infections. They're vexing difficulties for many men, often in the kind of younger age group. Actually, some of the treatments for the benign prostatic hyperplasia or benign enlargement of the prostate, or we also call it BPH, some of those treatments may be useful for this prostatitis group of men. in the future. We're only starting to look at that. But let me simply say that with time, with age, the prostate tends to enlarge.
Is that a normal or natural kind of thing? That
yes, it is. Basically, what is needed for this is testosterone coming from the testicles. So testicles and time equal enlargement of the prostate. Nobody knows exactly why. This may have to do with the interaction of the male hormone, testosterone, and the bit of female hormone that circulates in all of us. And it also may have to do with the interaction of the different cells in the prostate, the fibrous cells, the muscle cells, and then the glandular cells. But what happens is the prostate slowly enlarges with time and becomes troublesome after the age of 50 for about 50% of us, if we truly are cognizant of the problems. And basically, as you can see here, the bladder funnels into the prostate, and then urine has to go through the center of the prostate. Now, there are a couple of ways of examining the prostate and of looking at the issue. I know many men are a little bit reluctant to go into their urologist because they say they know they're going to end up with a rectal exam with the doctor feeling their prostate. That's true, and it's important. But the reality is that helps most with cancer, because when we do a rectal exam, we feel the back part of the prostate. And the prostate's a donut that we urinate through. And it's the hole in the donut that's important in terms of urination and the benign problems. So as the prostate grows, the hole in the donut gets smaller and smaller.
Okay.
And then there's back pressure. The bladder muscle, to accommodate for that, gets thicker. And the muscle bundles tend to stand out. The bladder, after a while, tires, if you will, and so the bladder doesn't empty as well as it could. And the patient feels like he needs to go frequently. And he will say that his stream is diminished in force and caliber. He may have hesitancy. He may have to either stand or sit there a while before he can initiate urination. It may stop and start, because there's actually another lobe in the prostate that acts as kind of a ball valve that can drop down and occlude the opening to the prostate. And sometimes most troublesome of all for these gentlemen is getting up at night to urinate. They just say, I just can't take getting up 3 and 4 times a night. I can't get back to sleep, and you know, I'm irritable the next day. So from a benign or BPH standpoint, these are obstructive symptoms. These guys just can't empty their bladder well. So all of the efforts in the past have been to try and open this up one way or another. The gold standard has been for over half a century to go up through the penis into the prostate and trim out the obstructing portion of the gland.
Now that's a surgical procedure.
That's a surgical procedure. It's called a TUR, a transurethral resection of the prostate. Many people will think of it as reaming out the prostate, and one will hear that from patients. This is a procedure that we've certainly shortened the hospital stay, as we have with everything, but it's a procedure that clearly works. It's still the gold standard. It will improve the flow, and it will diminish the amount of urine that's retained in the bladder. But it does so at somewhat of a cost. The patient is in the hospital a day or so. There's clearly bleeding, because this is done with a kind of a wire loop where one scoops out bits of tissue from the prostate that we then irrigate later out of the bladder. They almost look like little bits of bay shrimp. And so bleeding can be a problem. Although we go in and try to coagulate, bleeding can be a problem for up to 6 weeks. Patients cannot go back to vigorous physical activities.
Doctor, we've got and let me interrupt you here, we've got a break coming up, and after which we'll get back to this. We'll be back with you following this short commercial break.